Okay, we'll go ahead and get started. Good afternoon, and welcome to the eighth session of the KPCA Policy and Procedure Learning Collaborative. Today we're focusing on FTCA required policies and procedures. And in case this is your first session with us, I'm Jenna Massidi. I'm an attorney and healthcare compliance professional, and I work almost exclusively with community health centers and lookalikes in Kentucky and West Virginia. I'm going to pull up the schedule so you can see and always be able to refer back to what sessions that we've already had in the collaborative. That's because all of these sessions have been recorded, and so they're available through the KPCA. So if you're just now joining us, but you see something on this list that you'd like to see, then contact the KPCA and they will let you know how to access that recording. Again, we're focusing on FTCA today. And then next month, we'll look at procurement and contract retention policies and procedures. And then we'll actually wrap up the series in June by looking at policies and procedures related to coverage for emergencies during and after hours. So if you think any of those topics relate to one of your coworkers and you want to share that with them, that would be great. So today's presentation is going to be a little bit different from the other sessions we've had. That's because normally what I do is I start by looking at the Health Center Program Compliance Manual and what those requirements are. But I thought it would be more efficient for us today to go ahead and look directly at the calendar year 2026 FTCA PAL requirements, because that's the guide for this year's FTCA application. And really my goal today is to provide you with information on any of the policies and procedures that you need to have in place for your application completion and submission. And then at the end of the presentation, after we review those elements, I'll review a couple of common policy and procedure questions that I've received from health centers, and then give you a chance to ask any questions that you have. And then I also wanted to note, because we're focusing on FTCA and the application today, some of today's topics will have been covered maybe in more detail in previous webinars for purposes of operational site visit compliance. So I'm going to note when that's the case so that if you need to dive in a little bit deeper, you'll know which month of our webinars you can refer back to. And again, you can access those recordings for additional information. So as I stated, we're going to start by looking at PAL 2025-01, which discusses the calendar year 2026 requirements for the FTCA application. So you fill out the application in the year prior to when your coverage is going to be in effect. That's why it's a PAL dated this year, but it's for next year's insurance coverage. And I included the link here to the PAL, and I also included it in the resources section at the end of my presentation. So I'll make sure that Ashley has these slides to send to everyone who's here today, so that you'll be able to access any of these links that you see, or some sample language that I included in the slide. I wanted to start by just giving a few reminders about the FTCA application. So it opened February 27th, 2025, and this year they've given us a pretty extensive application window. It used to be, you know, if you've done this for several years, you'll know oftentimes they only gave you a month and a half to do all of the application and get it submitted. So this time we have a pretty good window till June 27th. The application sections are the same as they were last year. First contact information, which won't have any relevant policies or procedures. But the other sections are review of risk management systems, quality improvement and quality assurance plans, credentialing and privileging, and then claims management. So I'm going to, after talking about a few broad topics here. I'm going to divide my presentation up in the same way that the application is divided, and then kind of review the policies and procedures that are necessary for each of those sections. As I usually do, I think sometimes it can be helpful to include just kind of a one-page reference, like a quick reference you can look at to show, okay, what are the required board-approved policies that I need to have in place for this application? And then what are the required procedures that need to be in place but don't require board approval? So I've divided this up. We're going to review 4 policies today that have to be board approved, and I'll note that as we go through. And then 5 required procedures that you have to have in place as well. I also wanted to note that the policies and procedures that I just listed on the previous slide, you'll either have to do an attestation. So you'll attest under penalty of perjury that your health center has the relevant policy or procedure in place and all of the required elements in place, and you will check a yes or no box for that policy or procedure. So some of these are just attestations. You're just swearing you have that in place. They're taking your word for it, unless, of course, you have some sort of follow-up FTCA audit. The other policies and procedures require actual uploads. So this is where you still attest that your health center has all of the relevant policies and procedures and elements, but they're also asking you to upload the actual policy or procedure so that they can review it in detail before they grant you FTCA coverage. And remember, just because a policy or procedure doesn't require an upload for the application, doesn't mean that it's still not required and that all of the elements aren't required. If you were to have an FTCA audit, the reviewers would ask you to provide all of these policies and procedures, and they would review each of them in detail, even if you didn't have to upload them for the application. So you want to make sure that what you're saying in your application is accurate. So the FPCA, again, if you're a visual learner, I'm kind of a visual learner, so I like to start with a few things like this and show you, okay, what are the attestations that you have to do? Well, in risk management, you have to attest you have general risk management procedures in place. Under the QI/QA section, you have to attest you have a board-approved QI/QA plan, QI/QA operating procedures, and procedures that deal with the confidentiality of patient information. So again, you're just going to have to attest that you have those without actually having to upload those for the reviewers. The policies and procedures that you're actually going to have to upload under risk management, those are your 3 tracking policies. So referral tracking, hospitalization tracking, and diagnostic tracking. You will have to upload your credentialing and privileging operating procedures. And then you'll also have to upload a claims management procedure or process. I say that because all of these are, again, equally important when you're talking about crunch time and what you need to have completely airtight and board approved and ready to upload the application. This is your list. Now we'll look at some of these specific policy and procedure elements. And again, I've divided this into the same sections as the application. So I'm going to start with the review of risk management systems section. So you have to have, and this is the language from the application, you have to have risk management procedures in place. And I'll look at what these individual elements are here. But I wanted to note that these can be included in one large risk management procedure manual. So you might have one document that includes all of these elements, or these elements might be divided into various procedures. And either way is okay. So it doesn't matter. You don't have to have these all in the same document. You just have to make sure that all 5 of these areas are addressed in your procedures in some capacity. And then, I'm gonna look at what these 5 are, talk about what these 5 are, but note too that you need to really expound on each of these areas to show how your health center implements each of them, how you ensure the completion of each element on this list. So you don't want to just say, we do these things. You want to talk about the how, and you want to make sure it's accurate as to what your health center is actually doing as well. So at a minimum, you have to have procedures in place that, one, identify and mitigate, for example, maybe through clinical protocols or medical staff supervision, the healthcare areas and activities of highest risk within the HRSA approved scope of project. And this is going to include that information related to tracking referrals, diagnostics, and hospital admissions. So we'll get more into each of those individually in a bit. 2, your procedures need to discuss documenting, analyzing, and addressing clinically related complaints, near misses, and sentinel events that are reported by either health center employees, patients, or other individuals. You have to have procedures that show you set annual risk management goals and you track progress towards those goals. 4, you develop and implement an annual healthcare risk management training plan for your staff members that address the following identified areas: medical record documentation, how you follow up on adverse test results, obstetrical procedures, infection control, and HIPAA training. And then finally, your procedure needs to detail that you complete an annual risk management report for your governing board and key management staff, and that addresses risk management program activities, goals, assessments, trainings, incidents, and procedures. So I would actually take this page and use this as a checklist and find, where in the procedures is this located, what procedure contains this information, and if you can't find one, figure out where it fits best for your health center and make sure that this language is included, because whoever's reviewing your application, they're going to look for these keywords. So as close as you can have it to this, and then again, expound on it and then talk about what your health center does specifically, but this will point them in the direction and ensure that they would see. And again, I say reviewers, this is if you had an FTCA audit, you're attesting to this, but if you had an audit, they're going to look and make sure you have all of this in place. In terms of the tracking policies, I'm putting policies in quotes here, and I want to explain this a little bit. So these policies, referral tracking, hospitalization tracking, and diagnostic tracking, are required uploads for the application. I'm also going to focus on them a little more in depth because they're not addressed in any of our other webinar sessions. So I feel like we need to look at those a little more carefully. But note that I put policies in quotes because despite the fact that these are not listed as required board-approved policies in the compliance manual, and despite the fact that the application itself refers to these as procedures, you see it says upload the risk management procedures, and on the previous slide they're looked at as procedures as well. HRSA recently released some information both in their step-by-step application guide and the March 2025 webinar. If you attended the FTCA webinars that HRSA put on, they talked about this there as well. They said these 3 documents are required to have policy approval and signature by the governing board or an individual or committee designated by the board for approval. And they reference to the board authority section. I'm a little salty about this because I think, they've really pushed hard. What's a policy? It's board approved. What's a procedure? It's not. For the past several years, they changed these to procedures. So it used to say policy in the application years ago. They changed it to procedures. Many health centers have stopped getting these board approved. Some continue to get them board approved. But the fact is they did recently come out with other information that seems to indicate they're going to require these to be board approved. So in my presentation today, I'm going to address these as policies, and say they need to be board approved unless we hear otherwise. I did write to the Health Center Program Support Hotline and ask about this for additional clarification. And again, I'll send that to Ashley as well. If I get an answer on this, that anything is changing, I'll send that out as well and make sure you have it. Anyway, that's a lot of information, but I wanted you to understand why the language is different here from everything we've kind of been discussing in this series so far. So let's start by looking at the referral tracking. Again, I want you to use these bullet points as a checklist when you're looking at your policy. Make sure you have all of these elements. You need to demonstrate how your health center is tracking all referrals from origin to return, and then also evaluation by the provider. HRSA refers to this as closing the loop for referrals. So you want to make sure that your referral tracking policy talks about each of these areas. You want to ensure that the health center follows up with the referral providers, and you want your policy to specify the process and timeframes for the transmission, receipt of results, and follow-up if you haven't received results from the referral in a timely fashion. You want to identify the staff who are responsible for these duties, and you want to identify those staff by title. So you don't want to refer to them by name, right? That might change, and you don't want to have to update this policy every time that might happen, but you do want to identify the title, because I've heard some health centers have just said, hey, we have staff who do this, who track these, and HRSA has come back and said, that's not good enough. Or they've come back with an FTC application and said, that's not good enough. We need you to be more specific. So maybe your front office reception staff tracks these. Maybe you have the nurse of the referring provider is designated to do this. I know some health centers have designated referral specialists. So this is going to look different for each health center maybe, but you do need to be specific. You need to document all patient referrals and follow-up in the electronic medical records. So make sure that language is in your policy that you do that. And then specify how many and what kind of attempts will be made to contact the patient regarding follow-up of results or maybe a missed referral. So I recommend doing at least 2 things, right? Not just calling them once and calling it a day, but maybe you call them, you don't get through, so you send a certified letter. So just specify what that process looks like for your health center. All right, so hospitalization tracking. You want to demonstrate that the health center's tracking and monitoring system for receiving information regarding hospital or emergency department admissions. So you want to demonstrate what that process looks like for your health center. And that could be, again, very different. It might be you have an electronic interface with certain hospitals in your area, and you can automatically be alerted to or pull that information. You might use the Kentucky Health Information Exchange to try to get that information. And I know some health centers still just have a system in place with the hospital where they automatically receive maybe a phone call or a fax from the hospital when one of your patients is presents there for hospital admission. So again, this can look different for different health centers, but be specific in your policy as to what it is you do. Again, identify the staff members responsible by their titles for receiving this information and who's responsible for monitoring whatever mechanism that you use for receiving this information. You need to implement a mechanism to follow up with the patient or the provider or hospital to request any pertinent documentation that's related to that hospital or emergency department visit. And then your policies should discuss any scheduling of post-discharge follow-up appointments when appropriate. They want to see basically, does your policy discuss what happens after the patient's discharged? Maybe it's just that you need to follow up regarding certain medications. Maybe they need to come in for a visit soon. Maybe they just need a follow-up appointment in a couple weeks. But whatever that is, have some sort of system in place to ensure that you're Any questions so far? I know we haven't had a lot of questions at the end typically of these presentations. So if you have any as we're going through, feel free to ask them as you have them.
Hey, Jenna.
Yes.
Hey, this is Kelly Durrell. I do have one question.
Sure.
Earlier when you were talking about the policies versus procedures, we changed our tracking, referral, diagnostic, hospital, all those tracking, quote unquote, tracking policies to procedures several years ago and been submitting them successfully with no kickback. So do you feel like this year we need to change those back to policies before I submit? Because I got a board meeting in between. I have time to do it, but is that the suggestion or just kind of roll the dice?
I think you can do one of two things. The reason that I've been irritated about this is because I personally fill out multiple FTC applications, and I've done the same thing that you've done for several years now. We've submitted ones that are not board approved. They've been accepted without issue, and this has never come up. So I was really surprised when I attended those webinars, and all of a sudden they said, and make sure you have board approval, because nothing's changed in the application language. So I think you could do two things. I think I have pointed this out to them. I don't know if that's going to come out, if they're going to, what they're going to say. Hopefully they send something out to everybody once they make a decision. I think you can either submit it without board approval and know that they may kick it back and say, no, this needs to be a policy, at which point you would have to get that board approved and resubmit. They'll give you the chance to do that, right? So if they kick it back, that's not the end game. You do have a chance to fix it. Or you could go ahead and get it board approved while we're awaiting additional information on this. The fact that they said it during the webinar series and that they added it to the step-by-step guide they emailed out is what is giving me pause. So that's up to you. If you have time to have that board approved, the aggravating thing is you may get it board approved and then they say, no, you don't need it. And then next year you don't have to have it again. But the safest thing is to get it board approved.
Okay, thank you.
You're welcome. Any other questions? We will move on to diagnostic tracking. So in this policy, you need to make sure you demonstrate the health center's tracking and monitoring system that's maintained for all diagnostic orders, and it has to include x-rays and labs at a minimum. So make sure that you refer to both of those types of orders in your policy. You need to clearly define your critical lab values and the process for how the lab will contact health center providers with any critical results, and discuss the plan for both critical and abnormal, but not critical test results. And include the time frame for communicating these results to your patients. What's that method of communication? And what are the procedures for contacting backup providers as necessary? So what happens when a provider's on vacation and a critical lab comes back for one of their patients? What is the backup there? Who's going to contact that patient regarding that critical lab? Your policy needs to show that every effort was made to contact the patient for follow-up. And this includes contacting the authorities for help if necessary. So I've seen health centers go through FTCA audits in the past that didn't have a process in place for contacting authorities for help. And they got dinged for that. So they're saying, if you call a patient who has a critical lab and you can't get through, and then maybe you call their emergency contact, you can't get through to them either. You can't just stop there. If it's a true critical lab result, you may even have to contact the authorities for some sort of wellness check. So make sure you have some sort of language in your policy that accounts for that. You need to document attempts to contact the patient and identify staff responsible, again, for those attempts. And then those attempts need to include more than just a certified letter, especially, when we're talking about critical labs or abnormal labs. There should be multiple attempts to contact this patient. You need to either use a diagnostic tracking log or some sort of set workflow or process that closes that loop between the lab results getting from the health center back to the patient. So HRSA has come out and said that a really common area for malpractice lawsuits is that there's some sort of lab or some sort of diagnostic testing that's done. It comes back to the patient's medical record. It's reviewed by the provider, and somehow they click through and they don't get that result back to the patient. And then obviously something goes wrong, that could have been prevented had they immediately contacted that patient. So that part of the loop closure is really critical. And then just a tip that I have is don't make things too hard on yourself. So set realistic goals that are within the appropriate clinical guidelines. So an example is if the common clinical guidelines state, hey, you have 7 days to alert a patient about this type of non-critical abnormal lab. Don't make your procedures say you have to contact them within 24 hours. Because one, that's going to make things a lot harder than it has to be. And two, HRSA is going to hold you to that standard. So you're kind of setting yourself up for more opportunities to fail to meet your guidelines. So again, you want to meet the standard of care, absolutely. But don't try to overachieve to the point where your policy gives unrealistic deadlines. About the tracking policy. We will the next section of the application, which is quality improvement and quality assurance. This is a spot where I want to pause and point out we did a QI/QA webinar back in September 2024. So you can reference back to that video as needed if you need more specific information, more specific examples, that is available to you as a reference. But today I'm going to go through specifically what's needed for this section of the FTCA application. And I also want to note that all of the policies and procedures we discuss for this section require attestations, but do not require uploads. So we'll start by looking at our QI plan or policy. In this section, you are attesting that you have a board-approved policy. Again, it can be called a plan or a policy, but it's demonstrating that you have established and set up some sort of ongoing QI program that demonstrates the following 3 elements. That your program focuses on the quality and utilization of health center services, that it focuses on patient satisfaction and patient grievance processes, and patient safety, including adverse events. So you want to make sure that that's board approved, and then you can go into more detail on each of these in a correlating procedure that's not board approved. But this needs to be mentioned in the plan that establishes your program. I also want to note when you look at HRSA's FTCA FAQs, it says that the governing board must approve this QI/QA plan at least once every 3 years, and it should include the board approved date along with a signature from the board president or secretary. So when you are putting this together for an OSV, or if you have an FTCA audit, you want to make sure that this particular document is signed by the board and has been reviewed for 2 years. Then the application looks at a number of QI/QA operating procedures that sort of supplement that QI plan. So again, it's got these 6 elements. Use this as a checklist before you check yes on the attestation. And if you can't find any of these items, point to where each one is addressed. Again, doesn't have to be in one procedure. It can be set up however makes sense for your organization. But you need to make sure you adhere to current evidence-based clinical guidelines, standards of care, and standards of practice when you provide health center services, that you identify, analyze, and address patient safety and adverse events, and implement any necessary follow-up actions, that you have some sort of method in place for assessing patient satisfaction and reviewing those results, And then for hearing and resolving patient grievances. So you have to have some sort of process in place for that. That you complete periodic QI/QA assessments on at least a quarterly basis to inform the modification of the provision of your healthcare services. And then finally, that you produce and share reports on QI/QA to support decision-making and oversight by key management staff and the governing board regarding the provision of health center services. This QI section also is where they've included procedures related to confidentiality of patient information. So another one of the attestations states that your health center has implemented and maintains systems and procedures for protecting the confidentiality of patient information and safeguarding this information against loss, destruction, or unauthorized use, and that such systems and procedures are consistent with federal and state requirements. So I wanted to note on this as well, because this is pretty broad. So you're saying you have these procedures in place, and I'm sure all of you have something in place related to patient confidentiality. But I did pull up the FTCA audit guide. And so if you were to be audited, have an FTCA audit, the reviewers would ask for a copy of any of your HIPAA privacy and medical record retention procedures. And you'd want to make sure that those address the language above. Also, I wanted to point out that there are several examples of maybe related procedures that you might have in this area, this confidentiality area. So first, some sort of procedures related to HIPAA, and these procedures need to focus on privacy aspects of HIPAA, the security aspects, and then kind of the breach notification process. So if there was a HIPAA breach related to one of your patients, what's the process for that? How do you investigate it? Do you report it? How do you alert the patient? Is there any disciplinary action involved? So, having some sort of procedure that outlines that. You would want to look at having, again, some sort of medical record retention, release, and destruction procedures, procedures related to access and control of your patient record systems. Something that's becoming more and more important, having some sort of cybersecurity encryption or authentication procedures in place to show how you're protecting your patient information from hackers or malware or anything that they need to be protected from in the cybersecurity realm. And then procedures related to data backup and disaster recovery for records. So recognizing that you might be the only entity that has a copy of your patient's records, and if they're only available on your internal system and that system is flooded, is there any backup? How do they get like a backup server that contains that information so your patient's using all of that data? So just some things to keep in mind as potential procedures you might want to consider having. Again, these don't have to be uploaded, though, for purposes of the application, but I thought a little bit of a deeper dive might be helpful. Any questions about QA, QI? All right, we will go next to the credentialing and privileging section. Just like with quality assurance, we did an entire webinar session on credentialing and privileging procedures in October 2024. So again, we're going to review the key points that you need for FTCA, but if you need more in-depth information, feel free to look at that presentation. And then another thing I wanted to point out, if you weren't there for that presentation, credentialing and privileging are really two separate things. So credentialing, we're confirming that that clinical practitioner has an appropriate licensure, training, education, all of those things to perform their duties. But when we're talking about privileging, we're talking about authorizing that clinical staff member to perform a particular scope or set of services. So the application really focuses in on these as two different things as well, even though they're often going to be combined into one procedure. So we'll look first at the requirements for the credentialing section of your procedure. You need to make sure that your procedures relate to licensed independent practitioners, LIPs, other licensed or certified healthcare practitioners, or what HRSA calls OLCPs, or other clinical staff, if you have any. If you don't have any other certified clinical staff outside of those areas, you don't have to include them in your procedure. But if you do, let's say a certified MA, for example, if you have a certified MA, you should include them under other clinical staff. So make sure those areas are in your procedure and that they apply to employees, individual contractors, or volunteers if you have with your health. The procedures must address both the initial review of credentials and the recurring review. So if you do recredentialing and reprivileging every 2 years, we're talking about that recurring review. And you need to be doing that recurring review minimum of every 2 years. So these procedures have to address the checking current licensure, registration, or certification using a primary source. That you're checking the education and training for the initial credential. Note this will tell you whether we're talking, if it's silent, it means both. If it says initial, it just means initial. So education and training for initial credentialing, using primary sources for LIPs and primary or other sources like secondary sources for OLCPs or other clinical staff. You need to complete a query through the National Practitioner Data Bank, initially and on recurring review. You need to check the clinical staff member's identity for initial credentialing using a government-issued picture identification. You need to check their DEA registration, if that's applicable to the type of clinical employee they are, and then current documentation for basic life support training. So again, utilize this as a checklist and make sure each of these items is mentioned in the credentialing section of your procedure. In terms of privileging, it starts the same way. They require this for LIPs, OLCPs, and other clinical staff, whether they're employees, individual contractors, or volunteers. So you want to put that information there. You must address, again, the initial granting of privileges and the renewal of privileges. And this means verifying fitness for duty, immunization, and communicable disease status. For initial privileging, you're verifying current clinical competence via training, education, or reference reviews. When you're renewing those privileges, you're verifying clinical competence by peer review or some other type of comparable method. So maybe you're looking at some sort of supervisory performance review. And then finally, you need to have some sort of process in place for denying, modifying, or removing privileges based on assessments of clinical competence and fitness for duty. So it's not enough that you review these and call it a day. If you were reviewing for renewal of privileges of a clinical staff member, and it came back that there were real concerns with their clinical competence or their fitness for duty, you can't just say, well, we reviewed it, that's good enough. You have to have some sort of process that says, okay, if what we get back is insufficient and they're not meeting the standards here that we need them to meet, we need to have some sort of process for denying, modifying, maybe suspending, or removing their privileges. So have some sort of language in place for that. HRSA does have a credentialing privileging tool that I think is helpful for their policy or for their procedures. This is one that used to have to be a policy. Now it can be a procedure. Seems still sort of procedure. So, so you can click that link when you receive the slides to get more information there. Also, to do another reminder, I made this reminder in our webinar focused on credentialing, but if your procedure mentions in any, you've got to make sure it references HRSA PAL 2024-01 and limits these temporary appointments. So they will kick back your application if you say that you allow temporary privileges outside of the parameters of that 2024 HRSA PAL. So just again, make sure that that language is limited. And you don't have to offer temporary privileges. So if it's not in there, that's fine. But if it is, then it needs to adhere to this PAL. Any questions about credentials programming? Okay, we'll move on to the final section then that we'll be looking at today, claims management. In this section, you have to attest that your health center has a claims management process in place for addressing potential or actual health or health-related claims, including med mal claims, which might be eligible for FTCA coverage. You have to have a claims management process in place that includes information related to how you ensure the following: the preservation of all health center documentation related to actual or potential claims or complaints. So some examples of this: patient medical records, associated lab or x-ray results, billing records. One thing some people don't think of is there are HR records, credentialing records that might be relevant here too. So if there's any kind of employment or credentialing records for the involved providers, you need to make sure those are preserved as well. And then any clinic operating procedures that are relevant, potentially relevant to the claim. And then also you need to ensure that any service of process or summons that the health center or its providers receives relating to an alleged claim or complaint is going to be promptly sent to HHS, to their Office of General Counsel, as prescribed in the FTCA Health Center Policy Manual. So this is the part of this section where you are just attesting, yes or no, we have this in place. But you will also have to upload this particular process or procedure. So I wanted to talk about it just a little more in depth. You should talk about which individual has the health center receive and track notices of potential claims. So this is the person that you've designated as claims manager and who has the claims manager language in their job description. Again, you don't have to put the person's name, but maybe your risk manager also acts as the claims manager, or your CMO acts as the claims manager. Whatever that title is, but that should be in your procedure, because there really should be a point person so that these don't slip through the cracks and so that everyone knows who to send this information to. You want to talk about what the process is once these are received. And really, there's a lot of good language in the FTCA manual about this. But you want to remember to address litigation hold notices. So litigation hold notices are where you have to send out a letter to certain staff, and HRSA requires this if you have an ongoing, like a formally filed claim. You're going to have to send out a letter to certain staff letting them know they have to preserve all records related to that claim. So that's what we're talking about with the litigation hold notice. That way your staff can't say, well, I didn't know I wasn't supposed to delete the note or delete the policy or throw out this file, right? They know because they received a letter that says they have to hold on to it. You need to address the preservation and retention of documentation for actual or potential claims. Again, this says actual or potential. So if someone threatens to sue you, but they haven't filed it yet, you've been alerted that there's a potential claim. And so you really need to start following this procedure then in case it becomes an actual claim. You need to ensure that claims are promptly sent to, again, the HHS Office of General Counsel, and then that you put in the language that you will cooperate with HHS, the Attorney General, and any assistant U.S. attorneys assigned to the cases. And then finally, you need to include that you take steps to mitigate future occurrences. So HRSA really wants to see that if you have a lawsuit in a particular area, let's say it's OBGYN, that you're going to analyze the case, what went wrong, did anything go wrong, and how can we mitigate further occurrences? You know, do we need to change our policy? Do we need to do additional training? Do we need to require this provider to do additional CMEs? So those kind of things, but make sure you discuss that you do try to mitigate based on these. included some sample language based on the information in the FTCA manual. So I'm not going to read through this, but you will receive the slides and can have this to refer to. So if you want to kind of compare this language to your procedure, that's absolutely fine. And then also note, make sure this is accurate given your health center's specific setup. So never just adopt a template language without reviewing for accuracy for your organization. So definitely you can use it as a starting point or as a means to compare, but make sure it's specific to your organization. Any questions about claims management? Okay, we'll go through a couple common policy and procedure questions. One that came up during the webinars in March was, must the referral, hospitalization, and diagnostic tracking policy be separate, or can they be combined into one policy? And the reviewers said they have a strong for separating these into 3 distinct policies. So they said they very much prefer that. That's definitely what they recommend. But they did leave the caveat and say, if they are combined in any way, you must clearly identify where each of these specific areas is addressed. So if you have these combined in some way, I would make sure that the policy has like a clear header for each section. So it's clear to her exactly where that is addressed. Question, must the claims manager, risk manager, and IQA point of contact be separate individuals? And the answer to that is no. Depending on the size and staffing of your organization, they may be separate individuals, but if you're a smaller organization, you may have the same individual wearing multiple hats in terms of these designated roles. The important thing is that you have designated somebody for each of these roles, and you have them involved with the relevant process and with those policies and procedures, and they're familiar with them, and then that you have that language in their job description that shows that they're wearing a particular hat. So again, it doesn't have to be different people, but it does need to be specifically designated to somebody. That brings me to the resources page here. I've included that step-by-step guide that was linked to that from where it was sent by email, a link to the calendar year 2026 deeming program assistance letter. I did include a link to the Health Center Program Compliance Manual, which is still Chapter 21 of the that chapter is no longer a part of operational site visits. Then HRSA has FPCA technical assistant resources on the bottom left. I have a link there. There's a lot of great information on that landing page. A link to ECRI. I know most health centers utilize ECRI at this point, but in case you don't, I just wanted to point out that is a great resource that's free to health centers and lookalikes and primary care associations. And so they include a lot of sample policies, a lot of sample trainings, free staff trainings that meet the requirements of FTCA. And so I utilize it a lot personally when I complete FTCA applications. So if you're not familiar with ECRI, I included a link here on how to become a member. And again, if you are a health center, membership is free. And then finally, there's an FTCA tracking policy resource that HRSA's put together. So a resource kind of checklist specific to those 3 tracking policies that we discussed. So hopefully, if you have other questions, also, as always, I'll put my contact info. Need to send me an email, or you think of a question after the fact, or a question you didn't want to ask in front of everybody, feel free to call me or email me, and I'd be happy to talk through it with you. Any questions? All right. Like I said, we normally haven't had many at the end, so I'm glad we had a couple as we were going through. But thank you everyone for coming. And again, if you have any questions afterwards, just reach out to me. Thank you, and good luck on your applications.
Thanks, Jenna.
Thank you.
Thank you.
Thanks, Jenna.
You're welcome.